Hi guys, Dr. Adrienne Castrovinci with Healthy Living Chiropractic coming to you on this lovely Thursday today. I hope everyone's having a great day. We're going to continue on with a little bit of the topics we were discussing earlier this month and talking about body alignment because as chiropractors we do a lot with alignment. So we're going to talk about the body alignment during pregnancy and why it's really important for women who are pregnant or who are thinking of becoming pregnant to see a chiropractor. So if you're watching this and you don't fall into that special population, don't worry. I'm sure you know somebody in your life who is in that phase in life, who is looking at having a baby or has had one or two and looking to have more or is currently pregnant. I would love for you guys to share this video with them and help to inform them what types of things can help. You don't know how many times I hear from women who are pregnant who have said, I wish I would have known about you sooner. So please feel free to please pay attention and listen and share this with your friends and family. So, okay, the most important things I see and the biggest kind of common ailments I see during pregnancy is something that's called sciatica. So the sciatic nerve is a giant nerve. It's about the size of your finger that basically starts in the low back and kind of comes down where the pelvis is. I'm going to show you right here. Comes down here, comes underneath this little notch and runs down into the lower part of the leg. It innervates the leg. So when there is stress or irritation on that nerve, it can cause numbness, tingling, burning pain, things like that. Things that are extremely uncomfortable. And that's kind of the number one thing that women will experience during during pregnancy is sciatica. So the reason being is that obviously when the pelvis is, when the woman is pregnant, there is increased amount of weight in the front part of her body, in her abdomen, and that's going to cause that lumbar curve to increase. It's going to cause this pelvis to tilt, and the muscles that are back here that are running kind of through this nerve can start to tighten, because as the body's leaning forward, the mom has to counterbalance and pull back so that she can stand upright. So we get some abnormal movement in the pelvis, we get some unusual tightness in the muscles, and all of those create that perfect storm called sciatica. So what chiropractors do is we go ahead and we adjust the spine, we make sure that the hips are moving properly, we can do muscle work in these areas, we can also help in the middle, the lower part of the back too, to take pressure off of there. Give moms some good stretches to do. I've got a lot of massage types of techniques that can help too and really help these moms feel and function a lot better. It can take a couple visits, but for the most part, they tend to improve really quickly with the chiropractic care. So that's number one. Number two, the thing that we'll see is a lot of upper back and kind of neck stiffness, even leading into numbness and tingling into the hands. Again, if we're talking about posture, right? When the baby is forward, it's going to cause the mom to pull backwards. That's going to cause a lot of an increased curvature in her upper back because she's counterbalancing that extra weight. When there is a lot of stress and tightness in the mid-back, we can see headaches. We can see problems with shoulder pain. We can see pain between the shoulder blades, kind of that burning pain back there, which we'll see. When these muscles are really tight, especially kind of in this neck and upper back area and upper shoulder area, it can cause numbness and tingling in the hands. A lot of times moms will say, well, I've got carpal tunnel. Sometimes it's coming from the neck. So we want to address that, evaluate it, and see what we can do to kind of fix that cause. So the number two thing I see with with pregnancy, pain in the middle back and kind of some headaches. Number three is we're focusing on optimal baby positioning. So when a baby is inside the uterus, the ideal optimal position for a baby is to be head down and the feet and the legs to be up. That is what we want to see ideally with a baby. That's the best way for it to be born naturally. When the head comes out, that's just the way that we're designed. Unfortunately, what can happen is that babies can then turn into what's called a breech position, where the head is up and the feet are down. They could also get into what's called a transverse position or a sideline position, where the baby is like this, which is extremely uncomfortable for the mom and also not great for the baby too. So what we focus on in our practice is making sure that babies are in that head down position. And there's a couple of different ways that we do that here in our practice. So I am certified in a technique called the Webster technique. It was developed by a man named Larry Webster, who's a chiropractor, who really was doing it to help his daughter who was dealing with a breech position baby. And he basically established that looking at the tailbone and making sure that the tailbone is moving properly, so addressing that, and then looking at the round ligament, which kind of connects the uterus and the pelvis. It's looking at those two pieces, those two structures, and helping to create balance inside the pelvis. If the pelvis is twisted and torqued, and this guy doesn't move, so I'll use my hands instead. So this is the bowl of the pelvis. If the pelvis is shifted back and kind of twisted and torqued, what that does is it creates a torsion with the pelvis. The uterus is, while sitting inside that pelvis, if the hips are twisted and not moving as well as they should, that uterus can then find a twisted position because it is attached essentially to the body. When that happens, babies follow the path of least resistance. So if they're in a position and they're kind of confined here and the head isn't able to get down and engage in the pelvis as it's supposed to, it can sometimes go head up because it's not comfortable for the baby. It's not optimal. It's not what they're trying. It's not innate for them or natural for them. So what we do is we go ahead and we assess the mom. We check the legs, make sure to see what's going on with the hips and the pelvis. If the tailbone needs to be adjusted, we adjust that pelvis, and then we do some gentle kind of muscle techniques or gentle resistance technique, where I just put a little gentle pressure into that round ligament, and that helps to bring down that spasm and help to calm that round ligament down. The whole point with all of that is making sure that the pelvis moves really freely so that the baby can sit properly and the mom can feel more comfortable. So that is called the Webster technique. Some doctors use it only if the baby is in a breech position. I tend to use it in my practice preventatively. So as the mom is at that 20 to 25 weeks pregnant, we can start doing the Webster technique, and that really helps moms and babies to stay in that right position, and moms be a lot more comfortable during their pregnancy. So ultimately we want healthy moms and healthy babies. We want babies to be born with as least interventions as possible. We want the mom and the baby to have a good birth experience, and getting the Webster technique done during pregnancy is a huge piece of that. So kind of in closing, the three things we see: the problems with sciatica, which is the pain down the leg, pain in the upper back, and then headaches and numbness and tingling in the hands was another thing we see. And then making sure that the baby is in an optimal position for birth is really one of the most important things. So kind of like I said before, if you have someone in your life that is pregnant, thinking of becoming pregnant, I would love to have a conversation with them to help educate them on the importance of chiropractic care during pregnancy and help them to feel more comfortable during that time. Yes, pregnancy is a time of huge growth with the mom, changes in the body, and it doesn't have to be painful. It doesn't have to be a bad experience. Oftentimes, a lot of our moms we work on feel very comfortable during their pregnancies, and they have really good birth outcomes. A lot of our moms have really quick labors and quick births because of the techniques that we do and because of ways that we can help to train them and to get them ready for birth. So I hope you guys have learned something today. If you have any questions, please reach out. One thing I did want to mention too is that if your family members or friends are not in the Twin Cities area where I'm located in Minnesota, there is a network through the ICPA. That is the certification where I got the organization that I got my certification from, and they have a website. It's ICPA, the number 4, kids.org, and you can find a doctor there, and you can find a Webster certified chiropractor that can help you when you're dealing with these issues. So I hope everybody has a great day. I really appreciate you listening today, and have a wonderful Thursday. Bye.